Welcome, everyone. Today we will be going over women's healthcare in the USA. Um, women's healthcare in the United States is a multifaceted landscape influenced by a combination of factors, including policies, healthcare systems, cultural attitude, and socioeconomic disparities. While progress has been made in certain areas, challenges persist in ensuring equitable access to quality care for all women across the country. So there's three types of health insurance that you are able to receive. There's one from the government. So Medicaid is a government-sponsored health insurance program for low-income individuals and families. The second type of health insurance that you may receive is from your work. Once you start working, you may not be eligible for free coverage for Medicaid RMA based on your income. Some employers provide health insurance through employment. You can use this one. And you can also buy your own. So if you're employed and your employer does not provide health insurance or you are self employed, you can purchase a private health insurance plan from Penny Market or through a broker. So, what benefits does the Affordable Care Act cover? So some benefits include hospitalization services, prescription medications, preventative and wellness benefits, ambulatory services, maternity and breastfeeding support, mental health and drug abuse services, urgent and emergency care, laboratory services, and pediatric services, including dental and vision care for your kids. So, preventative care. The most common checkups for women are blood pressure, diabetes, blood work, healthy weight management, cervical cancer, and pap smear and HPV tests. Regular checkups and preventative care are super important for grown-ups to stay healthy and avoid big health problems later. They help find issues early, manage risks, and promote healthy habits so everyone feels better overall. So some things that we like to check for, as we mentioned in the last slide, blood pressure. So usually you would have to get that checked every single year. It is to check for heart disease, high blood pressure, stroke risk, and general health. So for the diabetes, the frequency varies. So please talk to your doctor during your annual checkup visits or if you have any concerns. Annual OBGYN appointments, it is recommended to check up every a year. So see an OBGYN once per year for a checkup. Doctor will screen for diseases like breast and cervical cancer as well as sexually transmitted diseases. OBGYNs will also discuss family planning like pregnancy planning and contraceptive options. Sometimes your primary care doctor can do this type of visit. Annual visits are free with health insurance, and you can request a female provider. So, what to expect at an annual OBGYN appointment? Urine tests for infection and pregnancy, height and weight monitoring, medical and reproductive history, questions about relationships and safety, pelvic exams, pap smear, breast exam, menstruation discussion, and birth control option. So, preventative care. While the ACA has improved access to preventative services such as mammograms and pap smears, disparities in screening rates persist, particularly among uninsured and underinsured women and those from racial and ethnic minority groups. So, mammograms, they are x-rays to detect breast tumors starting around age 40. Clinic breast exams, known as CBE, are physical checkups by healthcare providers, and breast self examination, known as BSE, are encouraged for self awareness despite recent debate on its efficiency. So pap smear, it is recommended to check it every 3 to 5 years. Pap smears, also known as pap tests, test for precancerous cervical cells and abnormal cells that lead to cervical cancer. HPV tests are also recommended to get around every 3 to 5 years. So the HPV test looks for the presence of the cancer-causing HPV virus in the cervix. It is done during the pelvic exam along with the Pap test. Most cases of cervical cancer are caused by infection with sexually transmitted cancer-causing types of HPV, human papillomavirus. Screening is important to identify early changes in the cervix by Pap smear and also to detect HPV infection and provide treatment early to save lives. So, female preventative care, which are 40 plus, most common checkups would be mammogram and colonoscopy. After 40, women should prioritize preventative care. Regular checkups and screenings like mammograms and pap smears help catch health issues early. Discussing menopause symptoms and hormone therapy with a healthcare provider can be beneficial. These steps help women maintain good health as they age. So, mammograms are recommended to get every 1 or 2 years. So, they are to find lumps, bumps, and other signs of cancer inside the breast. Mammograms play a vital role in breast cancer screening and early detection efforts in the United States. So, access to mammography services is facilitated through insurance coverage, community programs, and healthcare providers, allowing women to undergo regular screening to help ensure optimal breast health and early detection of breast cancer. And colonoscopy. It is recommended to get this every 10 years. So it is to find abnormal bumps, bad tissue, or cancer inside the intestines. So, contraception available to you. There are many choices to avoid pregnancy if you wish to do so. The decision to use contraceptive is up to you. Everyone has different bodies and preferences, so your doctor or medical provider is the best person to ask for advice. You can stop taking birth control at any time if you want to get pregnant, unless it is permanent. You may choose a form of contraception and change your mind later, and most options are free with insurance. Maternal health. Maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. Maternal health is crucial for the well being of both the mother and the child. Healthy mothers are more likely to have healthy pregnancies and give birth to healthy babies. Postpartum care in the U.S. is often fragmented, with many women lacking access to comprehensive support services during the critical postpartum period. Efforts to extend Medicaid coverage for postpartum care beyond the current 60-day limit are underway to address this gap in care. Pregnancy. In the US, pregnancy care typically involves regular appointments that become more frequent as the due date approaches. Expect about 10 to 15 appointments, with ultrasounds and tests to monitor the baby's health. While childbirth usually occurs in a hospital, cultural practices and birthing options vary. It's essential to communicate your preferences and concerns with your healthcare provider to ensure a personalized and safe pregnancy journey. So the process, birth in the US may look different than in your home country. It is common to have about 10 to 15 doctor appointments, all of which are important to attend for the safety of you and your baby. Ultrasounds, growth scans, and other tests are commonly used to ensure your baby is healthy. If a doctor ordered tests, it does not mean something is wrong. Labor and delivery almost always takes place in a hospital. There will likely be a few nurses, doctors, midwives, or assistants in the room with you. Labor and delivery. So, what to bring to a hospital? Prepare for a few nights away from home. You must have a car seat in order to leave the hospital with your baby. Children are not permitted inside of the hospital. Ask a friend or family member to watch them. Many monitors and devices are used during labor and delivery. This is normal. Patient rights. Your providers want you and your baby to be healthy, but ultimately you can decide what happens during birth. Ask questions if you are unsure of what something means. It is not considered disrespectful to ask your doctor questions, request changes, or refuse a medical service. As a patient, you have rights and you can always ask a medical professional for help. Birth certificates and welfare. Birth certificate and social security card will be mailed within 6 weeks. You should add the child to your welfare case before you receive these documents. Going home. 1 to 4 days after giving birth, you will likely be discharged from the hospital. You will need a car seat for your baby to leave the hospital. Hospitals also require your newborn to have a pediatrician appointment within a few days of birth. If you need transportation assistance, you can ask a nurse or a social worker. You will return to your OBGYN around 6 weeks after birth. If you have a health concern prior to that, talk to the health team or call your OBGYN. Well visit appointments. You will have many appointments with your pediatrician over your baby's first year of life. First appointment 3 to 5 days after birth. Other appointments 1 month, 2 months, 4 months, 6 months, and 9 months. After giving birth, you'll enter the postnatal period, which lasts about 6 to 8 weeks. During this period, the mother goes through many physical and emotional changes while learning to care for her newborn. You should plan to visit your OBGYN 6 weeks after your baby is born. It's important to make sure you are recovering after delivery. Stress significantly impacts women's health in various ways. Mental health. Women are more susceptible to stress related mental health issues like anxiety and depression due to societal pressure and multiple roles. Physical health. Chronic stress can lead to cardiovascular problems, weakened immune systems, and digestive disorders, which with hormonal changes influencing responses to stress. Reproductive health. Stress impacts menstrual cycles, fertility, and pregnancy, also affecting libido and sexual satisfaction. Coping mechanism. Unhealthy coping strategies such as overeating or substance abuse are common responses to stress, worsening overall health. Social relationship. Stress strains relationships and can lead to social isolation, reducing support networks. Work life balance. Balancing career and family responsibility adds to stress, compounded by workplace discrimination. So some techniques to reduce stress are 30 minutes of daily moderate exercise, mindfulness and meditation, progressive muscle relaxation, yoga, visualization, slow and deep breaths. Mental health. Prenatal mood and anxiety disorders, including postpartum depression, affect a significant number of women during pregnancy and the postpartum period. Increased awareness, screening, and access to specialized mental health services are needed to support women's mental well-being during this critical time. Access to mental health services. Many women face barriers to accessing mental health services, including stigma, affordability issues, and a shortage of providers, particularly in rural and underserved areas. So, some public health clinics that you may seek are Pennsylvania Community Health Centers and the Free Clinic Association of Pennsylvania. That is it for our today's presentations on women healthcare. Please let us know if you have any questions or concerns. We are always happy to help with any questions you may have. Thank you.